welcome to Dr. Faizur Rahmaan, a prosthodontist and implantologist who has been practicing for the more than last 2 decades. He is a unique combination of academics and lab skills, which has translated him into being the director of Anchor Dental Lab. The laboratory is a global service provider for all the needs in prosthodontics and is specialized in prosthetic work for strategic implantology. A very warm welcome.
Geometry has given us two great treasures. One is the Pythagoras theorem, and the other is the golden proportion, which is the 1:1.618 ratio. Leonardo da Vinci, Michelangelo, and many such gifted people had used these proportions in making timeless pieces of art. How can we use these proportions in making a smile? Respected members of the Implant Foundation, dear delegates, fellow masters and mentors, we are in the business of making smiles. A smile that enriches the soul of the wearer and the potential to last a lifetime, engraved in someone else's memory. A smile can be cosmetic or aesthetic. Cosmetic is something that you add upon, which is not permanent. Aesthetic is natural beauty. I believe that we as clinicians do not create aesthetics, but we imitate aesthetics created by God. So the value of our work lies in imitating nature. So to imitate nature, you need a good imagination, superior clinical skills, and a good knowledge of the anatomy of the face. I will make a blueprint, a suggestion, so that when we follow these things, we will be able to create uncompromised aesthetics for each and every patient that we work upon. This painting is called the Vitruvius Man. It was done by Da Vinci. It is said that he tried to imply upon the symmetry of the human body by virtue of the sizes and by extension into the universe as a whole. These are the different ratios that they worked upon: the golden proportion, the red proportion, which is the recurring aesthetic dental proportions, and the golden percentage. Morley in 1999 suggested various methods of assessing a smile. The first thing is the facial assessment, where you assess for the lip support, lip fullness, the nasolabial fold, mentolabial sulcus. These are the facial things that you want to record. There is no need to do any investigative procedure for this. You just need to record it on a piece of paper, or you need to do it as a case record for the patient. It is by observing the patient. Next is the gingival aesthetics. If there is not much of resorption, then you will be able to adapt the teeth directly on top of the tissues. Madam has already spoken a lot about adapting the prosthesis and the tissue interface. I will also speak a little bit about that, where you can just ridge lap the tissues directly on the teeth on top of the tissues, or you need to replace the prosthetic support for the lip because of extreme atrophy. Then we look at the microaesthetics, which is the size of the teeth, shape of the teeth, and the color of the teeth. And overall, you need to look at the position of the teeth itself and how they support the facial musculature, because as the patient ages, the tonicity of the muscle reduces. It has to be in harmony with those